My name's Fahanda. I'm the manager at Phoenix PCN. We have set up a new service to help you with increasing capacity at your practices. We're working with Response Physio Services to provide you with FCP MSK service. MSK means musculoskeletal, which means anything to do with joints, muscles or bones. FCP stands for First Contact Practitioner. Your FCP MSK specialists are Peter and Louis. They are not the same as physiotherapy services in secondary care at the L&D hospital, and I'll explain a little more later in the following slides. So what's the aims of the service? The idea is that most of these patients that get booked in with a GP around muscles, joints or bone issues can be now seen by these MSK specialists. So you can book directly with them, leaving the GP slots for other acute problems. This means more appointments for patients, more capacity for you. The patients will get to see the specialist that they need sooner, get the expert advice and required treatment or appropriate referral they need without delay. It reduces your waiting times and it frees up the appointments for you to book other patients. So the service that we've built is based in Kingsway Health Centre in the basement rooms. Appointments can be booked directly by the receptionist via remote booking. The rotas will be labelled MSK Specialist Rota Session. These clinicians are specialists in managing musculoskeletal conditions. They will triage patients to assess, diagnose and manage patients along the appropriate treatment pathway. They will only see patients over 16 years of age. So MSK FCP clinicians work in primary care to manage patients in the same way a GP would, by utilising their specialist knowledge and experience in this one area to triage and signpost patient. They are there to deal with those patients that would normally have been seen by a GP, and then where it falls outside of the GP remit, the GP would previously refer onto physiotherapy in secondary care. This is not a substitute for the physio service available at the L&D. It's just the ability to free up your GP appointments by triaging this specific cohort of patients. So you as front-facing staff are vital to achieving the aims of the service. By reception staff booking in the correct patients with the MSK specialist service, the GP appointments can be taken up by other acute or routine problems and needs. So patients can be seen faster, and happier patients means happier you. So all you need to do is on your System 1 at the top, Appointments tab, click on that, and then you need to click onto the remote booking. At the next window, if nothing shows up, please click refresh and make sure that it's ticked with show rotas for PCN Bramingham and all rota types. The appointments are clearly labelled PCN basement rooms at Kingsway Health Centre MSK Specialist Rota with date and time. The address is highlighted at the bottom, so do please make sure that patients understand this. We don't want them turning up to your practices thinking that they have an appointment with you. The best way to explain how the service integrates with your practices and helps you release capacity is if you get a patient with soft tissue injuries, sprains, strains or sport injuries, arthritis any joint, possible problems with muscles, ligaments, tendons or bone, i.e. tennis elbow or golfer's elbow, spinal pain including lower back pain, mid back pain and neck pain, spinal related pains in arms or legs including nerve symptoms, i.e. pins and needles and numbness, sports injuries, slip discs, sciatica, sprains, post-orthopedic surgery. These are the kind of patients that you can book directly in with our MSK specialists. Please do not book in anybody who is acutely unwell, children under 16, medical management of rheumatoid conditions, women's health, antenatal and postnatal problems, housebound patients because they will only be seeing patients face-to-face in the clinics, medication reviews for non-MSK conditions, neurological or respiratory conditions, headaches, acute mental health crises, patients who do not want to be seen by an FCP. So one of the simplest ways of remembering the types of appointments to book with our service is if the patient has a bone, joint or muscle problem or is experiencing pain and discomfort in any of the following areas: neck, shoulder, back, elbow, wrist, hands, hips, knees, ankles or feet, just book them in with an FCP MSK specialist. So to summarise the main points, they are not GPs and they are not secondary care physios. It's important that we meet expectations. If a patient comes in to see an FCP and thinks that they're seeing a GP, they are not going to be very happy. The service will open up your capacity for the GPs to see other patients by taking MSK-relating patients off them, by assessing, diagnosing and managing them for the GP instead. We have plans for them to be trained up to do more onwards, to be able to, for example, refer onwards themselves instead of sending back to the GPs to refer, and they will be able to request relevant radiology tests. Thank you very much.